Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Here we are. Yeah. Well, we've been traveling here, here in our nice little studio. Yeah. I'm ready to go after all, and we've invented
this is our tower control.
Right, tower control. We've just invented the Mencia travel kit. Right. And all these little goodies are going to go in here in a way. So I thought I asked Dr. Mencia, though, a lot of people travel with their pets.
Absolutely.
A lot of people drive in their car if they're going somewhere, older people.
And you were saying about your Snowy, he was hacking a little bit, and you took him to the bed, and it's like an allergy and was treated with antibiotics. So if you're going to travel, of course, if you're going to travel, you have kids, you're going to get your kids ready to come along with you. But if you have pets, get them ready also, especially if you're traveling out of the country and if they're coming with you. So if you have pets and you're going to travel, get your pet checked. See if their vaccination are up to date. Get whatever record you can. Some of the vets are well organized. They are very state-of-the-art. And you can always take the phone number with you, because if you are in another state, you can call your vet. And they will be able to talk bed to bed and see what vaccination your dog is due for. And when it comes to vaccination to pets, there are certain vaccinations that they give to certain pets, and they are contraindicated in other. Same dog, let's say, if we're talking about dog, there are some vaccinations that you cannot give to certain kind of dogs because they have a bad reaction to it.
Really?
Yes. And with my dog, Asisati, when I took the dog to the vet and it was time for the vaccination, the vet said, no, that kind of dog cannot have whatever the vaccination was that time. He stopped the vaccination. He said they cannot because they develop some kind of a stomach reaction to the vaccination.
You had a good vet.
He's
imagine.
Right. So I learned that. I didn't know that. So you want to make sure your pet is up to date. If one thing that he was saying, even if you have a dog in let's say Chicago, and you have a dog in Florida, the vaccination can be different. The treatment can be different. So take your dog to the vet if you're traveling, and let the vet know where you are going, so that they know if you should take anything with you.
And if we're driving in a car with all the heat, and we've heard about it.
Well, let's talk about driving.
Let's talk about driving.
Because driving, now a lot of times we think the elderly. Let me say the elderly and people that know that they have severe varicose vein. They are about the same. They are both prone to developing clots and developing cellulitis. And the main reason is not because a bacteria came and jumped into your skin and gave you the cellulitis. The main reason is that you're sitting too long and you are not exercising. You are not promoting the circulation of your lower extremities. So especially the person with severe cellulitis, of course, you want to wear good support stocking, or socks that come at least, your knee high. And if you are ashamed of wearing them, when you get off and you go into one of the rest stops, take them off for a little bit and go walk and put them back on where you are back in the car. But you don't want to be traveling. If you're going from here to Connecticut and it's, 24-hour drive, you don't want to...
The way you drive, it's more for 24 hours from here to Connecticut?
No, the way I drive is 48.
A lot longer. Oh. Oh, no, that's 2 days at least. Okay.
So you want to make frequent stops. You want to drive no more than 1 or 2 hours. And after 2 hours, you want to stop for a little bit and just walk around. Even if you have a little rest stop and you just want to walk around the car, just make sure that you are stopping at a safe place. And it's well lit So, there's a lot of people that, of course, take advantage of travelers. So you're stopping at a place that is safe for you and, walk. Do a little walking just to maintain good circulation to your lower extremity. And it will avoid, if you are in the process of developing a little clot in the leg, it will abort. Just walking will dissolve that clot and you are done. You don't need to take medication. You don't need to do anything. Just walk a little bit and your body will take care of itself.
But it's the same for the plane. You're saying
the same thing for the
in
plane.
A car, but
I remember when I went to Australia, it was such a long trip. So I would get up and I walk the plane, every hour or so. I just get up and just walk back and forth in the plane and go back and sit down and have another drink.
Yeah, no, but so you get very comfortable, or there are a couple of people sitting next to you, so you don't want to bother them. But I do a lot of times. I just try to get my legs up. I take them off the ground and kind of put them up. Hold them up there to do something, shake them. But the stockings are very important. That you
They're
said
very,
people
very,
should really get those.
Exactly.
Even if you don't have varicose veins, it's still important.
Even if you don't have
if you're
varicose vein, absolutely.
A long trip.
Right.
But let's go back to the car, because one thing that I remember when we were driving, I'd always keep one of the little coolers in the car. Because then you can have something if you want. You have a drink. Because sometimes you get on these big highways, and there's nothing.
You
there.
want to keep yourself well hydrated. You want to keep it, even when you fly on a plane. People don't. They think I'm flying. I'm sitting down. If you're going from here to California, you drink nothing. It's 6-hour flight. You can get dehydrated in 6 hours.
What happens when you're dehydrated?
So a lot of well, when you get dehydrated, you can get dizzy, fall down, break a hip. So you're traveling to visit your loved one and you are having fun and you are not there. You don't want to end up in a hospital for people to come and see you there naked. So you are traveling to have fun.
Yeah.
So and a lot of the employees that work for the airline.
Yes.
Part of their training, they learn that they have to drink because they are always flying up and down, back and forth. So they learn that they have to, drink a lot of water. So the passengers also. So when we travel and we are the passenger, we should drink water to keep ourselves well hydrated.
Now, can we be drinking juice? Or, I know we shouldn't drink soda, but, is it the same as water, just to keep hydrated?
Hydration, liquid in general. If you have a soup, you drink a soup. Soda, you have to be careful. Coffee, you have to be careful because those are diuretic. Those will make you urinate, will make you pee. So if you're going to urinate, and then you're losing fluid. So if you, instead of having a glass of water, like I'm doing here, you have an espresso. So that espresso is a strong diuretic. It's going to make you urinate.
But water makes you urinate also, doesn't it?
But that's okay. That's good. Because what you are urinating is the excess amount of water.
Oh.
So that is good. Some people don't want to drink when they are traveling in a car or in a plane, and you ask them why. Say, I don't want my ankle to swell up. No, let your ankle swell up. Just drink water. As long as you elevate your feet, you're going to be okay. So you need to replace the water, and when we are in a car, we were talking about in the car a few shows back that it only take 10 minutes for the temperature to go 20 degrees.
Yeah, you told us about that.
Remember? So, a person can get very dehydrated traveling in a car, especially if you don't bring down the window because you don't want to mess up your hair. So your windows are up, the sun is on, and you are traveling. Sometimes it's great to travel early in the morning or as the sun set because it's not so hot. But when you are traveling from here to Connecticut, of course you're going to travel during, the peak of the heat. And at that point, it only takes a few hours to become very dehydrated.
Now, I know that you are a geriatric physician, but I don't know if you are a weather doctor, too. So I want to ask you.
Oh, yeah, that's my other specialty.
Yeah, that's right, a weather doctor.
The weather doctor. That's a good one.
So we have weather conditions that we have to talk about when we're going, because this could be very dangerous if you're in a car and it's raining and there's, all sorts of things happening. So
don't be stupid. Don't be stubborn. Don't be hard-headed. If we are traveling in a car and you are in a unknown area, right? Travel and pull to the side. When you see the weather like that and it's really bad and you cannot see, you're just going to be prone to accident. Not because you are a bad driver, just because you're stubborn. And you just keep saying, I have to get there. I have to get to, I keep saying Connecticut, let's switch to Massachusetts. I have to be in Massachusetts before noon today. No, pull to the side. If the weather is bad, it's better getting there safe than ending up in North Carolina in some emergency room.
Yeah. No, you're right. And so I think weather conditions now can be very dangerous. And the other thing is there are a lot of, when people should take an extra pair of glasses. You know that? Because they lose their glasses, and then what do they do? So that is an extra kind of thing.
And if you're going to travel in the Mencia travel kit, if you're going to travel, go through your checklist of what should be if you are the driver or you are the co-driver, you are the passenger in the front. Go through a checklist of what you need to have there. Do you have the cooler accessible to you that you don't have to turn around to pick up the water? Do you have your glasses in front of you, your sunglasses and your distant glasses, so that you can see where you are going? If you have your phone, put it. I usually put my phone face down, because if a text come in, it won't distract me. I don't have to look at it.
Boy,
a lot of people, when they put their phone in their car, they put it facing up.
Yeah.
And
that's very interesting. I do, and I will start doing that. Thank you.
Put the phone facing down so you won't look at the text. You will not look at anything until you stop the car. What I do, if sometimes I take my car in for service and they give me a loaner, immediately I stay in the car and I program my phone through the Bluetooth so that if it rings into the loaner. So I want to drive, hand-free and be able to talk hand-free. So if the phone rings, it will ring into my car and I'm able to answer the phone.
Yeah, make sure you bring a charger.
Right, I'm a doctor, so sometimes you have to talk on, you
have
to talk,
exactly.
You have to be giving order to a pharmacy or to the hospital or to a nursing home. So as a doctor, you have to have the phone with you, but you also have to be safe. So do the same thing. I mean, for God's sake, you have the Bluetooth. If you don't know how to do it, just go to a dealer and say, can you connect my phone to my car? And they'll do it for you at no charge.
I'll have to do that.
I
haven't done that, really. I probably should do that. But don't forget to take your charger for your phone, because that's a lot of things that people wind up, they don't have it in their car to be able to do that.
Take your charger with you, so that if your phone battery is going low, you have your charger connected. So go through your checklist. It's like, I remember one of the things that I learned as a pilot is that the most important part of flying was the pre-flight checklist.
That's right.
They say if you want to fly safely, always go through your pre-flight checklist. And you can never, cut corner with a pre-flight, because that's what's going to tell you if that plane is safe or not before you take it up in the air. So go, before you get in the car, go through your pre-flight checklist. And I say, if people drive, the thing that we learned for flying a plane, if we apply that to a car,
good point.
You will never have an accident, because, people don't check on the tire pressure before they get in the car. They don't check on how much gas they have. When was the last time you changed the oil in your car? And, sometimes you go and then you end up with an accident and you say, well, I'm in America. So being in America, that means anywhere in this country, I'm going to end up in a good hospital. Come on, get your head out of the sand. I remember I was a chief resident when I was in internal medicine. And I went for an interview in some small town in Pennsylvania. So they brought me into Pennsylvania for an interview. And of course, being a chief resident, I did a lot of minor surgical procedure, and I love surgery. I wanted to be a surgeon, so I did a lot of minor surgical procedure. I put a lot of central line in for the patient that were very sick. I delivered babies, so I done so many. I love surgery so much, and but I was so good in internal medicine that everybody said you have to be an internist. So I became an internist. But I remember going to this hospital. And it was a beautiful interview, nice hospital, small town. And I say, okay, so if I have a GI bleed, do you have a GI doctor to cover if I need consultation? Then they go, no, you are it. I say, okay. And in the emergency room, they have nurses in the emergency room, and they have a doctor that cover. But when the doctor go home, then you become it. If it's your patient is there, you have to take care of your patient. So I say, oh, so if I have to put the line, you have to do everything. Well, if I'm one of the major hospitals here in South Florida, we just call the surgeon. I need a central line. I need this. They don't want you to do it, even though you have done it in the past. They want you to call the individual that do it more frequently than you do, which makes a lot of sense. So because you are traveling and you are in America, don't think that if you have an accident, you're going to end up in a place that you're going to have access to a neurosurgeon and a GI doctor and a cardiologist that does invasive procedure. Don't think like that. You might have a doctor there that just, their job is to get you stable if they can and then ship you out. So
that's a good point, because we are spoiled down here. There's a hospital almost on every 10 miles.
Right.
So when there are some places and you are going up, especially in the hills in the, North Carolina and areas that they are very small. There are
very
these little
small,
clinics and all, but you're right. If you have something serious, I think, with all listening to you and what you've said is, if you are a patient that's had a lot of problems with your heart, or your lungs or some serious things, you have to be very careful where you travel. Right. And maybe going by car isn't exactly the right thing to do.
Right. And it can be fun. I mean, traveling by car. I remember when I first moved here from Hawaii, I went to the south. I went to Texas. And then from there, I took the Greyhound bus, and I traveled all the way to Washington, D.C. by bus. And it was so amazing. I got to see, so many states. I got to talk to so many people. Coming from Hawaii, that we don't perceive discrimination, and now we get here, and then when I'm in the South, I say, wow, it was. I would be
all of a sudden, you're going to go in the back of the bus, buddy, right? You're not going up in the front.
I would be calling my mom. I say, Mom, I want to go back home. I don't want to be here.
That's true.
Yeah.
But it's funny that I love to go. Actually, silly. I like to go on a bus, but I love the trains. I love to go on a train, and there aren't many trains, but that's also a favorite.
I did that in Italy. I went from Rome. I went to Florence, and by train, it was so beautiful.
Europe has wonderful trains. That's how everybody goes. It's a beautiful thing to do. Well,
so traveling. If the other thing, if you're traveling by yourself, is one thing. You have to do your pre-flight checklist and go through your process. But if you are traveling more than two individuals, it is not proper for the rest of the crew to fall asleep and just leave the driver by themselves.
That's very important. Sleep, driving.
While driving. So what you want to do is you want two people awake at all times. So if it's 4 of you traveling or 3 of you, one person is allowed to fall asleep, the other 2 are driving. And this is one of the things that we learn flying a plane. You have a pilot and a co-pilot. And sometimes you have a third person in the cockpit, but that person can go and take a nap. It's okay. As long as 2 people are always up. And, plane, you put it in auto fly, and they go by themselves. But still, you have to have 2 people there.
That's very, very good advice.
So the same thing when you are driving your car. If you see that the car is swerving, you say, oh, we need to pull out. Let's stop. Or if the weather is too bad. If I'm the passenger and I cannot see, I know you cannot see. Let's stop the car. Sometimes you need a person to push you to do the right thing. So it's good to have two person always awake.
That's very
and
good
if it's
advice.
only two of you traveling, don't fall asleep and leave your significant other or whoever is driving the car by themselves. Stay awake. And that will save your life and prevent you from having an accident.
Well, this has really been a wonderful, wonderful show, Dr. Mencia, about
time
traveling.
fly when you're having fun.
Yeah, no, but you've done a good thing for people. I think what you've said is it's like a flight check. Even if you're going, even like Enos going to Orlando with his son to Legoland, it's still she's traveling, so she should still have some of the things that you said.
Absolutely. When the last time that Ina have those tire change or rotated?
Yes.
Because she traveled in her car probably just from work to the supermarket and to home and this, short travel. This is going to be a 3 or 4 hour travel that she's going to be doing. Go and get your car checked by the mechanic. Make sure that you have your son medication or whatever you need for your kid. The history, if you're taking a pet with you, take the pet to the bed, make sure everything is okay with your pet before you go anywhere. Just, make it a fun travel.
Right, and make sure that you have a lot of extra clothing. I mean, this is kind of funny. Sometimes people don't realize, they take their shorts and then it gets cold.
Right.
And they don't have an extra jacket.
Exactly.
They don't have a raincoat because we know it has rains. I always carry in my purse a little umbrella. I have a tiny little umbrella that does open up. And so, people wind up not really thinking, but if they had a flight check. But if we do this little Mencia travel kit, I think...
I have some of my pants, pajama, they are a little bit warm. So sometimes when I'm traveling, what I do, if I have shorts on, I put in the back the pant pajama, and I can stop, put them on. What you don't want to do, especially if you are the driver, don't put a blanket on you. Oh. That is so stupid. Don't do that because you are supposed to be using your feet to step on the accelerator, step on the brake. So don't put a blanket on. Because, don't do that.
How about driving barefooted? Oh, I am very guilty of my shoe hurts, so I take my one shoe off my right foot.
They're so comfortable shoes. They are nice shoes nowadays that you put on. They are called driver shoes.
They're driver shoes?
They are driver shoes.
Where do I buy driver shoes?
I don't know. I know what I have one.
Know.
I have one, and when you look at the heel, the sole of the shoe come into the heel. I'm
going to get driver shoes.
And then when you are sitting down and you are driving your car, your feet are comfortable now.
Okay, I'm going to go find driver shoes and keep them in my car.
Yes.
Right? And I'll just take on my heels and put them on. Mm-hmm. Thank you. See, we have 1 minute left to go. Dr. Mencia, we have not done what we always supposed to do. It's been too interesting. Okay, so we have phone numbers. So we're going to call. They're open today. Go down there. Beautiful.
Both offices are open today.
Both offices
Hagen
are.
Ranch.
Oh, my gosh. Hagen Ranch. Okay, well, let's give the Hagen Ranch Road. It's 561-270-6494. And the Fort Lauderdale office is 954-489-1345. And you can always go on their website, which is agifl.com. So if you haven't been to the Boynton Beach office, it's beautiful. You want to go there. Again, it's 561-270-6494. Call for an appointment, whether it's dental or medical. And absolutely, Dr. Mencia, though, you're going to be down at the Fort Lauderdale office,
the Fort Lauderdale office.
So you want to see Dr. Mencia, this very, very attractive gentleman who is so nice to people, and he always looks so good. 954-489-1345. He's over on Commercial Boulevard. And if you are looking for a fantastic dentist, they have a beautiful dental department, and they do
with
such
all
good
the
work.
Specialists.
All the specialists.
All of them.
Yeah, it's a pleasure to go to Dr. Mencia's office, I have to tell you.
We can make you smile.
Okay, well, we'll be back right away.
And the Boomer Time magazine.
Boomer Time magazine, you can
we're
always
gonna
pick
put a
them
nice
up there.
article since it's summertime, we're going to put a nice article for people. We're going to call it what? The Mencia Travel Kit.
That's right, Mencia
We're going to put
Travel
a nice
Kit
article for you.
Yes. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.